Hi all, today we will learn how COVID-19 leads to ARDS. What is COVID-19? COVID-19 it's a disease and it is caused by SARS-CoV-2. It is a type of coronavirus and most of the infected people have only mild or moderate respiratory signs and symptoms. It does not require hospital admissions and recovered at home. But in some, it can lead to severe respiratory signs and symptoms, leading to acute respiratory failure and ARDS, that is acute respiratory distress syndrome. And today we will learn how COVID-19 leads to ARDS. How is coronavirus transmitted? Coronavirus is transmitted mainly through respiratory droplets. That is, when the infected person cough, sneeze, these infected droplets are exhaled, and when it is inhaled by another human, it enters the upper respiratory tract, causing upper respiratory tract signs and symptoms. The inhaled air is filtered and humidified before entering into the lower respiratory tract. But if the virus enters into the lower from the upper, it reaches the lung alveoli. What is lung alveoli? These are tiny air sacs. It is found in the lungs where gas exchange takes place. That means carbon dioxide is removed from the blood vessel and oxygen is provided to the blood vessels. So what happens if the virus travels down to the lung alveoli? So now the virus has entered. This virus has spike protein, S protein. This protein acts as a key to enter inside the cell. This S protein get attached to ACE2 receptors. ACE2 is angiotensin converting enzyme 2. These ACE2 receptors, these type of cells are found in the alveolar cells. So the spike protein get attached to the ACE2 receptors and act as a key to unlock and enters inside the cell. So inside the cell, this virus multiplies or replicates, now causing infection, causing pneumonia. So what is body's response? Now there is an infection. So the body's response is the production of cytokines. What is cytokines? These are proteins and it is produced by different types of cells. This helps, it act as a messenger, protein messenger. It communicates between the cells and it signals the immune system. It wants the immune system to fight against the virus. There is a virus present. Now we have to fight against the virus or pathogen. But in some people, what happens is cytokine storm. What is cytokine storm? That is excess production of cytokines. There is a lot of production. There is a lot of cytokines are produced. As a result, it leads to uncontrolled immune response. That is, immune system are supposed to attack or defeat the virus or pathogen. But when there is a cytokine storm, there is excess production of cytokines, which are proteins, which signals the immune system. But when there is excess production, it leads to uncontrolled immune response. That is, it attacks body's own cells. The immune response damages body's own cells. So this cytokine storm leads to diffuse alveolar damage. That means it damages the alveoli and it damages the blood vessels. So when the blood vessel, when the endothelium, when the blood vessel is damaged, this capillaries, the blood vessels get leaky. It leaks. As a result, plasma fluid in the blood with proteins leaks into the interstitium. Interstitium is a tiny space between the alveoli and the capillaries, and oxygen in the alveoli diffuses through the tiny interstitium into the blood vessels. Now, because of the leaky capillaries, the interstitium is filled with plasma fluid with proteins and the fluid leaks into the alveoli. So now the alveoli is filled with fluid. Normally or before infection, the alveoli is clear and oxygen diffuses into the blood vessel. Now, because of the infection, this alveoli is filled with fluid. So diffuse alveolar damage leads to capillary permeability. That means leaky capillaries fluid gets filled. In addition to this, there is formation of hyaline membrane. What is hyaline membrane? The alveolar cells are damaged, and these dead cells and proteins in the fluid get accumulated in the alveolar cells. So hyaline membrane is a membrane of dead cells and proteins that accumulates in the alveolar cells. As a result, now the oxygen cannot diffuse or oxygen cannot pass to the blood vessel because there is fluid and there is a formation of hyaline membrane, that leading to ARDS. That means blood cannot get oxygenated. The patient maybe is on mechanical ventilation giving medicine. The blood is not getting oxygenated, leading to ARDS, acute respiratory distress syndrome. In addition to that, alveoli cells are damaged. So the alveolar cells cannot produce surfactant. What is surfactant? Surfactant produced by the cells, it prevents the alveoli from collapse. So there is no surfactant because the cells are damaged. That finally leads to alveolar collapse. So in short, this is the normal alveoli where you can see a thin layer of surfactant. It prevents the alveoli from collapse, and the oxygen diffuses through the interstitium, a small space, into the blood vessels. But because of the cytokine storm, there is increased capillary permeability. That means leaky capillaries. Fluids leaks into the interstitium and into the alveoli. Alveoli gets filled with fluid. Formation of hyaline membrane. That means dead cells and protein accumulate in the alveolar wall and oxygen cannot diffuse into the blood vessels. In addition to that, there is no surfactant. Surfactants are not produced by the alveolar cells because of the damage, finally leading to alveolar collapse. So today we learned about how COVID-19 leads to ARDS, and thanks for watching my video.